Hi, I'm Dr. Jessica Vartanian, licensed marriage and family therapist, and I help high achieving professionals find their worth outside of achievements. Today, I'll be diving into 5 of the most commonly asked questions regarding family, attachment, and boundaries. So let's dive right in. So, our first one is, why do I feel guilty setting boundaries? So, this is one of my favorite questions to answer because it's something that I see in my clients and support my clients in working through. So, the answer kind of lies into the past experiences that we might have gone through where we might have tried setting a boundary in the past. So, maybe we tried saying no, right? We're asserting our needs, expressing what we want or desire, and it was met with some sort of backlash or disagreement, some maybe overreaction that made us feel either emotionally or physically not safe in our body. And then somehow the message was also, aside from not feeling safe, the message might have also been something along the lines of their needs are more of a priority and more important than your needs, and that it's wrong or shameful to be thinking about yourself versus someone else, or before someone else rather. So again, somewhere along the lines, either a time or two with a person or a couple of different people, that might have been the past experience where the body kind of picked up on this message again that it's not safe or that it's not right to put yourself first, or assert your needs. So the good news is that therapy, like resources like therapy, you get to learn how to feel safe in your body again, and learn the communication skills and the self assertion, to be able to assert yourself and set those boundaries that you might want in relationships to feel like you matter and that your needs are just as important as others. Okay, so our second question is it okay to distance myself from family? Yeah, this is one of those questions I think really helps to be able to work through one-on-one with someone and explore where is this question even coming from, right? Like why is this question there? What are the emotions beneath the question? What are those experiences that maybe led us to have this kind of question, right? Like, is it okay to distance myself from family? So I could imagine as a therapist that there might have been some, again, an experience or two or few just kind of adding up maybe over time that made someone wonder, like, is it time or is it okay to do this? And the answer is yes, like it is okay, like it is an option, of course. But at the same time, like what would that look like, right? I think that's one of those other things. Like, yes, maybe you realize like it might help me to put some sort of distance, but to what degree, like with whom, what would that look like, for how long, right? Those are maybe some other like subsequent questions that you might have after this particular question. So I think having someone like a therapist, a mental professional who might be able to help you explore those questions too, or the answers to those questions, can be really beneficial. So yes, it is a possibility and an option if that's what feels right for you at this time of your life. But exploring it with someone that knows how to guide you with those questions can be really beneficial. So our next one, what is attachment style? Yeah, that's a great question too. Attachment styles. So I guess to dive into a little bit of the theory, it kind of started from 19 maybe mid 1950s. There's some research with John Bowlby and Mary Ainsworth, who really wanted to understand the kind of like parent-child dynamics and how children react when parents, let's say their parent or caregiver is in the room with them, or when they left the room, and how are they responding when they're leaving, and how are they responding when they're coming back. And what they notice is that like each of these kids or these toddlers, not everyone looks the same in their responses or their reaction, and they have very different feelings to the situation at hand, and again, like how they were responding to the caregiver being gone, how they're responding when they came back. It was very telling and helped them kind of develop both this attachment theory, but then from there, these different attachment styles. So essentially, there's 2 categories. There's the secure attachment, where a child growing up has a secure base to turn to. They feel confident and secure that the parent will be there, and even when they're gone, that they'll be confident that they'll be back. Someone who's also like emotionally attuned to that child growing up, so they feel safe turning to support, turning for help, and again, confident that that individual will be there for their well-being and for their safety. So that's the secure attachment. And then the other category was insecure attachment. And beneath that, there's different varieties of that as well. So there might be the anxious attachment and something also called anxious avoidant attachment. So those might look a little differently, where with anxious attachment, someone is nervous, like if someone is gone, or they might not feel as confident and secure that they're going to be back. So that plays a role in how regulated they are in their emotions or in their nervous system. They might have a lot of anxiety about this person's absence. And anxious avoidance might be someone who's a little ambivalent, like they might have both this anxiety about this person not being available, but then not know how to turn to for support or help, either ask for that attention and care and love. So those are some of the main ones. There might be one or two that I'm missing in there, but that's what attachment style is essentially, and it kind of driven from the research in the past and these studies done by those two authors. So the next question is, how does childhood affect adult relationships? So this one can actually be tied to the one before that, which is what is attachment style. So by being able to kind of do that research and learning how kids develop these different kind of attachments to their caregivers or their parents, it really kind of shows us how much of the early kind of building blocks and blueprints that are being developed could then play into later life and grown up or adult relationships. So when there's a safe, secure foundation, then the child is being able to feel safe and secure in their body, so they feel maybe more trusting of others and also trusting their own intuition and their own feelings, and they're learning about themselves through their parents. But when there is some sort of, let's say, traumatic experience where the caregiver or caregivers aren't either able to be there, both physically and emotionally, or they're physically there but emotionally maybe mentally absent because they're going through their own life experiences and stressors, whatever the experience might be, that could create some sort of insecure attachment in the child, and the child hasn't learned how to feel safe with their own body, with others, with the world. So that might cause some kind of people-pleasing behaviors where they're trying to keep the other person happy in order to feel safe. They might be perfectionistic, so they feel like things are out of control and chaotic. So they might try to, plan things and make things go a certain way and be perfect. So it could create that sense of security and control that the maybe child didn't have later on in life. So those kind of early experiences in childhood can be that blueprint later on in life, and as far as how someone is relating with adults. How someone's relating with others as an adult later on in life. So again, it's kind of like what the brain is learning or the nervous system is learning as to what to do or what needs to be done to feel safe and to feel connected to someone else. So that those kind of become coping or survival strategies early on in life. But later on, if you're noticing those strategies aren't working for you anymore, like you did it as a child, you needed that at some point, but it's not working for you anymore, that's where a resource like therapy can come into play, where you get to learn where these behaviors came from, where these patterns came from, which ones do you want to still keep, which ones do you want to let go of, and what would that look like for you moving forward if you want different and more healthy relationships with yourself and with others. So therapy can be a good resource to be able to explore that and again learn new, more effective coping strategies. So let's move on to our last question. What is generational trauma? So this one can actually also be tied into that other question of what is an attachment style. So basically, based on one generation's like life experiences, if they're going through some sort of stressors and trauma, and they're developing this coping strategies and belief system based on those experiences, and they haven't had a chance to maybe heal from it and feel safe again, and they're living with those belief systems, then that becomes something that's transferred to the next generation. So for example, if there's a family that's going through hardship, let's say financial scarcity, and they don't know when their next meal is going to come, for example, and they're developing this belief system of we need to stay safe, and then the next generation is learning the patterns of the first generation, even though maybe their circumstances are really different. So another example, if someone went through an experiences where it created like distrust of the people in their life, and they didn't really get a chance to work through it, so now their belief system is it's safer to never trust anyone, to never be vulnerable, for example. And that can also be passed on to the next generation. So they're living, even though maybe they didn't have the same experiences as the earlier generation, but the belief system and those messages and the way of living, the survival strategies can be passed on to the next generation. So that is what we mean by generational trauma. So even though you're not going through it currently yourself, and you have very different life circumstances, but the one generation above you or the one before that had their own belief system already in place and their survival strategies in place that's teaching you how to live your life. So working through it again in for example, trauma therapy with a therapist who understands those experiences and how they can pass on can be really beneficial to learn where these coping strategies even started from. Again, kind of similarly before, like what's working for you, what isn't working for you, and what would you want to see differently for yourself, and how to make it happen. So those are the 5 questions for today. I hope you find this video helpful. If there's any other questions I can answer, drop them in the comments below and I can make another video like this. Thank you so much. Take care.